Hello everyone, my name is Razel Ortigas and this is my presentation for my scholarly project entitled SMS Appointment Reminders, Its Effect on Reducing No-Show Rates. For my committee, my DNP chair is Dr. Fairs, my Nurse 707 instructor is Dr. Snell, and my community member is Ms. Villa Serrano. The aim or purpose of my scholarly project was to conduct a retrospective chart review to determine if the implementation of short message service or SMS as appointment reminders at a private mental health clinic significantly decreased its no-show rates. This project also investigated if SMS reminders are a comprehensive and efficient reminder system to address non-attendance among psychiatric patients. This is because continuity of care contributes to effective health maintenance. However, no-shows challenge it and are more evident in mental health. Forgetting is the most predominant patient reason for non-attendance. After reviewing many literature, there are three themes that can either pose as a barrier to or a validation to implement SMS reminders in reducing no-show rates, namely social demographics, health history, and cost-effectiveness and convenience. In outpatient settings, social demographics may influence no-shows, such as the distance of the patient's residence to the clinic, socioeconomic status, educational attainment, age, civil status, gender, support system, and primary language. There are higher incidences of missed appointments for newly discharged inpatients, and notably, males are apparently more likely to no-show than females. Lastly, language is also a factor, as participants who are more inclined to consent for SMS reminders are those with English as their primary language, despite sending SMS reminders in Spanish for the Spanish-speaking population. Health history is also a risk factor for missed appointments. Chronic illnesses, for instance, contributes to non-adherence to both medications and appointments. For example, alcohol abuse or dependence. Alcohol dependence emerges as the most recurring premise, as patients with a history or current alcohol abuse are more likely to miss or cancel their appointments. Participants who kept their appointments were less often diagnosed with a substance abuse disorder. Also, patients who have an exacerbation of mental health symptoms contribute to no-shows because psychiatric patients are twice likely to not show up to their appointments than patients attending a primary care clinic. In this generation, SMS messaging is no longer isolated to personal use, but is also implemented in healthcare. SMS offer instantaneous communication, are inexpensive, and are generally accustomed by different socioeconomic groups. They are cost-efficient in encouraging patients in self-managing their conditions after discharge. SMS are also reliable, as contact is direct and the chances of them being misdelivered are less likely. Compared to phone call reminders, SMS are deemed discreet by consumers. Lastly, the initial implementation costs of SMS reminders were reverted by the upsurge in retained appointments, which makes them cost-effective. The theoretical framework that was used to guide this project is the theory of bureaucratic caring by Marilyn Ray. This theory impacted the formation of this project because of its essential elements or concepts, and from the word bureaucratic itself, it means it is a cohesive system in organizations to uphold the quality of healthcare. Using this theory as my theoretical framework impacted this project because this project entailed the cooperation and contribution of different healthcare entities to make adherence to appointments successful. As you can see in the image here, there are 7 concepts that contribute to caring, which are spiritual or religious, economic, technological or physiological, legal, political, educational or social, and ethical, all of which are involved in the implementation of SMS reminders. The methodology or design used to answer the purpose of this scholarly project was a non-experimental, retrospective, quantitative descriptive study. As a retrospective study, this scholarly project utilized available information that has been already documented by the private clinic or research site for purposes other than research. This project explored the association between 2 variables, in particular SMS appointment reminders and no-show rates. Chart reviews were conducted and a survey completed of the number of no-shows that occurred before and after the SMS appointment reminders were implemented. The only source of information used for this project were patient charts or electronic medical records. The research setting was a private mental health clinic located in the central region of the U.S., and in terms of recruitment, there was no direct patient contact that transpired because it involved retrospective chart reviews. So instead, eligible patient encounters were selected from a list provided by the clinic manager. Included on this list were patients who had appointments during the indicated time frame. A letter of approval was also obtained from the clinic owner before the data collection commenced. As for the sample size, 77 EMRs pre-SMS intervention were reviewed, and another 77 EMRs post-SMS intervention were also reviewed. This makes a total sample size of 154 EMRs. The inclusion criteria for the sample include adult patients or those ages 18 and over of all gender and race with at least 1 psychiatric diagnosis. These patients must have a confirmed appointment, and for the post-intervention data, the patients must have been prompted by SMS reminders. The type of statistics used to analyze the data collected was the z-test for the difference of 2 proportions. This type of statistics is appropriate and more suitable for the purpose of the scholarly project because it explores the association between 2 variables, in particular, SMS appointment reminders and no-show rates, and answered the research question of whether a variable is accountable for the change in the other variable. The results of this scholarly project showed that the no-show rates decreased from 35 to 21% after the implementation of SMS reminders, which is a statistically significant result as the p-value is equal to 0.0241 or is less than 0.05. As for the socio-demographic variables, patients who have English as their primary language, their no-show rates decreased from 37% to 19%, which is also a statistically significant result as the p-value is equal to 0.0125. However, there were not enough evidence to suggest that SMS reminders effectively reduce patient no-shows when based on the research subject's gender, distance of their address to the clinic, and other primary language. The results of this study can be summarized through this table. From here, you can see all the numbers that were accounted for each variable, and by just objectively looking at it, you can see that almost all of the numbers decreased, indicating an improvement in no-shows, albeit only 2 of which are statistically significant, as mentioned earlier. This bar graph essentially shows the decrease in no-shows, with some slight increase in 21 or more miles from the clinic and other primary language. The following are determined to be the limitations of this study. First is data availability. Since the study involved retrospective chart reviews, I was limited to information that was available to me, and there were also missing data, which made me modify the data collection sheet. Next is the sample size. Although the G-power analysis indicated that 77 EMRs was big enough to answer the question of whether SMS was effective in reducing the patient no-shows in a private clinic overall, it was not enough to truly characterize or embody the population value of my social demographic variables, because it became smaller when it was allocated. Lastly, the associations between the outcomes and the interventions indicated by effect sizes may have been influenced by socio-demographic factors, but these associations may have been affected by effects that were not measured in this project. This is another identified limitation of the study, as some of these effects could threaten the internal validity of this design, which includes history and maturation. For example, the long-term effects associated with the passage of time that were not directly caused by the SMS reminders. Reactivity, such as the patients may have behaved abnormally, which if they were aware that they were being observed in an experiment. And the regression toward the mean, which such as measures that are greater than average at the pretest tend to automatically become smaller at the post-test, not because of the direct effects of an intervention, but due to the indirect effects of random chance. Overall, the results of this study show that they are consistent with other studies that SMS reminders were an effective reminder strategy in reducing patient no-show rates, and are also effective in reducing no-shows among patients with English as a primary language. And although the results are not statistically significant, it is still consistent with other studies in terms of gender, particularly that males are more likely to no-show than females. Lastly, the results are also consistent with other studies that state that the bigger the distance between the patient's residence and the clinic, the more likely it will be a no-show. Overall, the no-show rates decreased from 35% to 21%, and that there was an improvement in missed appointments from 1/3 of the sample size to 1/5 of the sample size. The outcome of this project can be applied to nursing practice, as it meant reducing patient no-shows. By doing so, this project cultivates health promotion by way of maintaining continuity of care, as well as attaining the best patient outcomes through treatment adherence. It can also increase patient satisfaction through the provision of sound and dependable healthcare, and by improving healthcare accessibility. The outcomes of this project can be used as a basis for the development of healthcare policies, particularly in the prevention of patient no-shows. Since SMS reminders were proven effective in reducing the no-show rates of a private mental health clinic, the healthcare policy can involve guidelines and strategies in implementing a cost-effective reminder system. Furthermore, these guidelines could elaborate more on the frequency, timing, and interactivity of the SMS reminders being sent based on current research and patient preference to make the reminder system even more effective in reducing patient no-shows. In conclusion, the outcome of the scholarly project showed that SMS as appointment reminders reduced the patient no-show rates of a private mental health clinic, and with respect to patients with English as a primary language, which is also congruent with the results of many contemporary experimental studies. Future studies are recommended for a bigger sample size to garner statistically significant results in the effectiveness of the SMS reminders towards different socio-demographic factors. Lastly, to enhance the effectivity of the SMS reminders, an investigation involving the timing, frequency, and interactivity of the SMS reminder system is also advocated. Moreover, what I would do differently is that I should have visited the research site ahead of time, because when I got there, my purpose was just to conduct the study. I didn't expect that I met with a slight dilemma when I got there, when I discovered that 2 out of 5 of my intended data were not part of the private clinic's intake questionnaire. Therefore, those data were essentially non-existent. So what I did, I have to amend my data collection sheet right then and there. Also, I would have stayed in contact with a statistician. The most challenging chapter for me was chapter 4, which involved the statistical analysis. It would have been helpful, I think, if I truly understood the ins and outs of the statistical tool that was involved, and particularly how numbers such as the sample size was determined, because it was Dr. Pauls who gave them to me directly, and I was not the one who actually figured it out. And also running Microsoft Excel, it was also a challenge to me, because it's been a while since I've used such program, especially in making my bar graphs. And what I have learned in this DNP project journey is that time management is crucial. Procrastination is absolutely out of the equation, and surely things can be done, as I have worked full-time all throughout this program, as well as doing clinicals. And I was able to do my assignments on time. Lastly, bear in mind that perfection is not always the answer. Initially, I was saddened that I only got 2 statistically significant results, but the more I contemplate about it, I think this is research itself. You can never really tell what you'll get or what you will expect from your experiment. And if you have any questions about this project, I am more than happy to answer them for you. And these are the references I used for this presentation. And that concludes my presentation. Thanks for joining me.